Good evening, my dear students. Today we are discussing about one of the topic in genetics, developmental delay. So, what is the developmental delay? Developmental delay, its simple definition, it is a lag in the child's physical and behavioral or emotional or social development compared with the normal person. That is called as a developmental delay. What is a developmental delay? Lag is occur. Means for example, in normal people, normal children's mostly seventh or eighth week, seventh or eighth month, teeth development is start. But in the developmental delay, 10th month, sometimes 11th month, sometimes 1.5 years, sometimes it takes 2 years also. That is called as the developmental delay, right? So the developmental delay, simple definition, it is a lag in the children's development, lag in the lag in a child's physical development and behavioral, emotional and social development also. Social development, this type of characters is delay, this type of characters is lag is occur. Compare then, this type of characters is compared when with the other normal persons, other normal childrens, we observe this type of character, that is called as a developmental delay. So developmental delay, it is decides by the depends upon their age factor, also depends upon their age factor. So developmental delay characters is how to decides, depends upon the age. Already mentioned one point, teeth development, it starts from the seventh month or eighth month onwards, so depends upon the age is decides. And baby walking, it just starts from the 12th month or 12th month, mostly 12th month or below 1 year. So sometimes it's a delay, postponed to the 1 year, 2 years, 3 years also, that is also called as a developmental delay. So this one is how to occur in our body. So first one is a reason, first genetical characters, second one is the ultimately environmental characters. In the genetic subject, one type of problem is occur. First reason is a genetical problem, second reason is an environmental problem. Mostly these two type of problems is the effect on the any genetical diseases and disorders are developed by the these two characters. First of all, we'll go with the genetical factor. So genetical characters is, so chromosomal abnormality. Chromosomal abnormality. The chromosomes are 46 chromosomes. The chromosomal 46 chromosomes. So any chromosome replaced with the one type of chromosome replaced with another type of chromosome, like a mutation, and this type of characters is developed in the body. For example, down syndrome, the down syndrome is the best example for best developmental delay characters. We already discussed about down syndrome in the previous class, just check once. And now we'll go with the environmental characters. And here one more point for you. So consanguinity, mutation, and these are the characters are related to the genetical factors. So now we'll go with the environmental factors. Environmental factors means, so here risk to the exposed to harmful agents before or after the birth. In case mother exposed to the environmental risk factors, so environmental risk factors, or sometimes after birth also, baby also affected to the same risk factors to develop the developmental delay problems. So for example, poor malnutrition. So here, so malnutrition supply to the mother and supply to the baby also. And the next one exposed to the toxins. In case mother is exposed to the toxic substances and alcohol consumption and tobacco and smoking. These characters and sometimes are drugs also, drugs, addicted drugs. So go with the mother, this type of problems, and baby also exposed to this type of characters. So some problems is developed, and the only mother is in case exposed to the HIV, chronic related diseases and disorders, affect to the development of baby also. These are the some characters related to the environmental factors. So now we'll go with the what are their signs and symptoms, how to decide. This is a developmental delay character, how to decide. So first one is the signs and symptoms. So signs of the developmental delay. So first one is the behavioral characters. First one is the behavioral characters. So first one is the behavioral character. First character is does not pay attention. Does not pay attention. Attention. And the next one, they are not focus on the focuses on the unusual objects. So usual objects up to long period of time. They are the focus on the objects long period of time. And the next one, they are the first second character is the so less eye contact. Less eye contact. So here decreases the eye contact. They are not focus on the particular things. Eye contact also. And the next one, violent behavior. Violent behavior. And the next one, stress in space and rocks. And this type of characters is a frustration and aggression behavior. These type of characters are identified in the behavioral symptoms. And now we'll go with the one more symptom is the gross motor symptoms. Gross motor warning symptoms, signs and symptoms. So here flappy or limb body position. So we'll have a floppy or limb body posture. And the next one, use one side of the body. Use one side of the body. Use one side of the body more than other sides, and a clumsy manner. These are the some characters are identified in the baby. And the next one, so vision warning, vision related characters. So vision related difficult to following objects. First one is a difficult in following objects. So the next one, rubs eyes frequently. And the next one, difficult in findings also. Difficult in finding. And difficult to focus also. Difficult to finding. And the next one, and the one here one are sometimes one eye abnormal, sometimes both eyes also abnormal eye formation. These are the characters. And the next one here, hearing characters. Now we'll go with the hearing characters. So here very I either very loud voice, either soft voice. Very loud or very soft voice. And difficult to responding when calling, so they are not well respond. And the next one, difficult in understanding and following the directions also. And sometimes ears are appear small or deform also. So ear characters, so appears small or deformed, appear smaller, deformed. So these are the signs and symptoms of the developmental delay. So the developmental delay is how to screen the developmental delay. So depends upon the measurement skills, developmental measurement skills, and the different types of techniques also available. So what are the techniques? Number one is the battle developmental inventory screening test. So first one is the battle development inventory screening test. This test, and this test is mostly used to the determination of 12 to 96 weeks baby identification of abnormal characters, identification of abnormal